Hello everyone, my name is Dr. Vallabh Chawla, specialized in oral medicine and radiology, and today I'll be sharing some valuable information on how to use the CBCT software. So firstly, when I send you a software, it will usually be in compressed or zip format. You just have to press on the folder and right click it and extract all. So automatically your compressed files will become unzipped, and you can see this folder over here, and you just have to double click it and you just have to open the viewer. Sometimes you may get a notification, run, don't run, so you have to press run anyway and then press OK. So this is how the software will appear on your screen, and it takes around 5 to 10 seconds to load. Also make sure that you have a good mouse with scroller option available with you. So once the software is open, you'll see various sections such as axial section, which is this one, the coronal section, and the sagittal section, as well as a 3D volume rendering view. These are nothing but the orthogonal planes which we talk about usually, and they are nothing but XYZ view. So in this software, first you'll see the XYZ view, the curved MPR view, dual CMPR, and this histogram. This histogram is just for your need to adjust the brightness and the contrast. So you can adjust the brightness and contrast as per your need requirement, or just press auto. So this automatically will adjust contrast, and also you can press right click and adjust the contrast accordingly. You can go to presets and choose your best preset for the bone, soft tissue, then automatic as we had explained, and then accordingly you can just adjust the filters here. And you can also sharpen up your image by pressing this S and choose the level of sharpness and then unhide the histogram. So coming to this, just to know about the software, what you basically have to do, just drag the mouse without clicking any buttons of the mouse. Just take your mouse to the buttons. It will automatically show or hide the positioning cursors, then view the histogram window, see images in 1:1 ratio or magnifying. So let's talk about each button in a detailed manner. So this is basically show or hide positioning. So it basically hides or unhide your lines which are seen. Histogram button I've already explained. Now this is see your images in 1:1 ratio. So now the images which you are seeing here is basically you have these black borders around. So just to see the images in 1:1 ratio, you just have to press this, and accordingly you see the black borders are also hidden, and now you can see the images in good manner, and in their magnified images. Now you can also get a detailed view about the specific image by using this magnifying button. So accordingly you can see the images in good manner. As you can see, this is a case of pulp stone which is present inside. Okay, so just press 1:1 button and you can see the images as you had seen earlier when the software is open. Now coming to XYZ view. So usually when you open up the software, sometimes you get an image like this. This is nothing but the images that are seen in XYZ view. The red line signifies the axial view, green line signifies the sagittal view, and blue line signifies the coronal view. And accordingly these sections are made. So we'll just talk about these sections now. Once you get a software, sometimes you may see the images in this manner. Now to hide or unhide them, you just have to press this button again. And now also about the volume rendering, you can also get a good view of volume rendering in all directions by using your scroller button. So just scroll away or scroll towards you to get a proper magnified image of that specific region of interest of yours. And also by pressing the CTRL button and left mouse key, you can rotate the volume rendering images according to your need. And by pressing the shift button and left click of the mouse, you can shift the position of your volume rendering images. And just by pressing the left key, you can drag the volume rendering image and see your area of interest. Okay, now I've adjusted according to my need. coming to this button, this is nothing but create a volume movie. So basically, if you want to see your 3D volume rendering in all directions, or if it's just for your patient education purpose, or if you want to give any lecture for the academic purpose, you just have to press this button, create volume rendering movie, and then accordingly you can increase the seconds or the frame rates according to your need, and just select whether you want Z rotation or Y cut, and save as. Where I'm saving is in desktop, and just name the file as, for example, 1, and press save. So automatically the volume rendering movie is created. This is going to take around 5 to 10 seconds. Again, it takes around 10 seconds, and you will see the volume rendering movie. Alright, so the volume rendering movie is ready, and you can just have a look at it. So basically you can see the volume rendering image in all directions, and for basically good for your patient education purpose. Now coming back to the software, this is volume rendering image. VOL is nothing but volume rendering image. You can change it according to your need, to maximum intensity projection or RASM image. Now I'll just press on maximum intensity projection, so automatically you'll see this goes blank. So you just have to press on histogram and go to grayscale, and just bring the histogram section and bring these lines towards the histogram, towards the voxel side basically, and just according to your need just adjust the contrast. Now you'll see a good view of the volume rendering image again from, and you can just drag it, right click it, and adjust accordingly. Okay, now we also have RASM images. For RASM images, it's basically, again, you can just drag these lines and the procedure remains the same. You just have to adjust. Only for 3D volume rendering you have to use this color option. So you can, and this is only for applicable only for 3D volume rendering. You can just adjust the color according to your need. Okay, and now if you want slightly orange color, you can just adjust these on histogram, and accordingly you can modify your 3D volume rendering image. Yeah, coming to this button, synchronize the slice and volume rendering. So you just have to press this and synchronize to volume rendering. Sometimes when you open up the software, you'll get like this, in this manner. So now you just drag it to your left side accordingly, and all these slices will move. So some of them you may find it uncomfortable, so you can always hide it by pressing it again over this. Or you can also synchronize according to slice images. So once these slice images move, even the volume rendering image will also move. So as you can see it now, if I want to see only the anterior region, I'll get it towards the anterior region, and the same way even in the volume rendering you'll get it in the anterior region. But I'll prefer to hide it, or you can say decouple it, as you can see. And now what is this? Reverse the Z direction. So basically this is nothing but it will change the images in different planes. This is just for your it will just reverse, or you can change the side of the images. So but I'll prefer it to keep it this way. Hide the histogram, and now coming to set the volume orientation. So this is basically, you get this orientation option here. You can just change according to your need. Orientation indicator position. This is bottom left. If I want it in bottom right side, so you can just change it accordingly. Okay, you can also hide it or unhide it, but it's always better to keep it on. Now if I want to view everything in the frontal view, so you just have to press this, and accordingly it is seen in the frontal aspect. If I want to see it in axial view aspect, you can just press this button and see it in axial view. and you can do the minor changes just by rotating the volume. Okay, now I'll prefer to keep it in frontal aspect. This option align the volume with currently selected implant. This option is applicable only once implant placement is done. So now coming to CMPR view, basically these buttons are disabled and they will only get activated when I press this button CMPR. So if I press this, automatically these buttons get activated and XYZ view buttons get deactivated. If I'll go back again to XYZ view, these XYZ buttons get activated and CMPR view buttons get deactivated. This will play an important role only once we start using the measurement tools and measurement and overlay, as well as these tools which are mentioned here. So coming to CMPR view, we'll just draw a MPR spline on this actual image. For example, this is the spline. Spline is nothing but arch marking, so I'll just draw a spline. So you can hide or unhide the mid sagittal line. The gray line is nothing but the mid sagittal line, and you can increase the thickness of these lines just by increasing the size. Increase the size of these lines, and the intervals of these lines can also be changed. Now this is interval 2 mm. You can bring it to 1 mm also. And this is, you can customize your interval lines to, for example, this is 1 mm. I can get it to 0.00 as well. But also we have to keep in mind, once these interval lines are increased or decreased, the images seen will be totally different. For example, if we decrease the size of interval to 0.00, the images will be more sometimes appear to be a little noisy compared to interval lines which is at 1 mm or 2 mm. So we'll just get it to 1 mm for now, and you can also change the thickness. For example, in this reconstructed panoramic image, the thickness right now is around 8 mm. You can get it to 1 mm also, so you'll get a better view of the image. And now you can see all the cross sections accordingly. Now coming to show or hide the FOV line. So go to XYZ view and just press this button, show or hide the FOV region. Once this region is seen, a black box appears, a yellow box appears. So just press on this and adjust it according to your need. If you want to focus only on the anterior region or only on the left side of the arch specifically, so you just have to get it here and just press double click on the corner of the yellow box. Once double clicked, you'll get a better view of that slice. And also you can use a magnifying glass, but again here the image is little noisy. So usually you can just double click and use a magnifying glass without the yellow box. Okay, you can hide this box just by pressing this button on the measurements, annotations and implants. Just unselect it. So right now we are done with this view, XYZ view and CMPR view, which I'll be coming soon. Now coming to filters, measurements and tools. So filters, basically, as I explained, you can just increase or decrease the sharpness according to your need. This gamma filters, other filters such as gamma, sigmoid, you can use, but it is not much required, because once I use it, automatically you can see the image contrast changes accordingly, and hence not much recommended. But you can apply these advanced filters according to your need. For example, ultra high. These are basically to detect any specific anomalies you may require it, but it may not be required while normal reporting. So now we are done with all this, so I'll just hide them filters. Now coming to measurements. So basically this is nothing but select tool, select or unselect. For example, now suppose if I want to use this measurement tool, I'll just do the measurement on the axial section press on the lingual cortex and till the buccal cortex. I'll just press this. So basically you have done this measurement. Now you can see this plus sign which is there. Now if I want to get rid of this plus sign, I'll just press this again, the select tool. So again, now you can do the adjustments according to your need, wherever you want to place the measurement tool. If you want to remove this measurement, you can use this eraser and just press over it. And now we'll come across, we'll see how to use this measurement tool in CMPI view. Now go to your CMPI view and just use this. Now again this eraser tool is there, so I'll just unselect it. Now coming to this measurement tool, just if you want to measure the cortex from lingual cortex to buccal cortex, you have done the measurement and just an approximate measurement here. Okay, so just again to get rid of this plus sign or the measurement tool, I'll just use this unselect option. Okay, now you can bring the measurements accordingly. Again, this is just an approximate, since we have not started with the norm marking, so these are just approximate measurements. Okay, to remove this, you can either press this and press delete button on the keyboard, or you can use eraser. Okay, you can also measure the angle according to your need, so you just press this and accordingly you'll get the degrees, but again not required in reporting. Now you have something known as create 2D annotations. If you have any anomalies which you see, for example, now I'll just come here towards this molar region, you'll see a pulp stone here. I've just focused it on the pulp stone area, so you can use this 2D annotation and this arrow button here and just mark the arrow there, and you can give this is text option and right over there, pulp stone. Okay, and again press the select button, unselect the text option and press the select option, and you can just do the changes accordingly. Just right click over it, apply your fonts. You can change the font. For example, now I'll use Comic Sans. Okay, so this one, and bold. You can increase or decrease the size of your font. 26. Okay, so this is how you'll see pulp stone. Okay, you can increase or decrease the size also. You can change the color also. Now 22 size is too big, so I'll just prefer 12 right now, and just decrease it, and you can just increase or decrease the size of your arrow as well. Decrease size and pulp stone. Okay, you can change the color of the arrow, or the you can also change the color of your text and change the color of your arrow. Okay, also you can just lock it as well. So basically when you hide or unhide it over here, so basically lock option, yeah. Okay, right now we have this show option, so lock option is not is disabled, so you can delete it and change or increase or decrease size. Now you can align the font also in the center or according to the left side, and you have other options also available. Now right now I'll just erase this, and there are many other options where, for example, you can place a line over, and you can also, this is just line option and not a measurement tool. You can scribble it, you don't have to scribble it, but you can just show it to your patient for patient education. And also you can add arrows as mentioned, and shapes such as circular shape, or you can also give a square shape, yeah, and if needed you can delete it. So now coming to tools option, the draw MPS spline line. As I've already mentioned here, like in the previous CMPR view, how to draw a spline line, you can also draw the spline in dual CMPR. So what exactly here is we are talking about is like you can just drag the axial section and make it coronal, and you can just use this draw a MPS spline according to your need. Like if you want, you can put two spline together, two arch forms together. That's hence the name is given as dual CMPR. This is the first spline line, and you can see the axial sections. Now again you can change the and just change the size, and you can also change the interval to 1 mm. You can change the thickness to 2 mm or 0.5 mm basically, and you can just have a look at the pulp stone as seen in the 7th section here. You can just increase the size here and make cross sections visible, number of cross sections visible to 7. Okay, and now dual CMPR is nothing but you can make another spline in another region or the same tooth. If we just see, you can put another spline here. Suppose I want to place it like this on the same tooth, so you can now see the sagittal images, sagittal sections of the same tooth. You can just delete it and put it somewhere else, so you come to know about both the teeth together. Okay, so you can see the pulp stones are evident in both upper maxillary and mandibular. This dual CMPR is not applicable on the curved MPR view, so you always need a dual CMPR view to make two spline markings. I've already mentioned about the show or hide the FOV region. Now coming to mark the nerve canal. So now to mark the nerve canal, you need to first do the spline marking properly. So just make the spline. You can do it till premolar region, or you can bring it to the other quadrant as well. Yeah, so we are done with the spline marking. Now also go to your XYZ view. Before going to XYZ view, I'll just make the changes in thickness. I'll keep it to 5 mm to make it look more presentable. Also just adjust the spline points accordingly. Yeah, as we adjust the spline points, we can always see there are changes in the reconstructed panoramic view. Yeah. Okay, so we are done with this. The previous nerve markings, I'll just delete it. Yeah, so again go to your select tool. Now we can see the mandibular canal properly here in this reconstructed panoramic view. What we'll do, we'll also go to the XYZ view and do the changes accordingly. Orient your axial and the panoramic axial and the sagittal view so that you can see the mandibular canal. Yes, now you can see the mandibular canal properly in this section. Yes, perfect. And now go to your cross-sectional images. Just bring it close to the mental foramen region. We know mental foramen lies in the premolar region between two premolars. So just bring it to the premolar region. As you can see, yes. So the mental foramen is seen on the buccal aspect of the mandible. Now press the nerve canal. So the left click, it won't activate. You always need to press right click and then activate the nerve canal. So you have to go behind. Now as you see in some cases where it's not seen in the CMPR view, so what you can do, you can always use a XYZ view and accordingly do the changes. Now I can mark it here as well. You can just zoom this image or just drag it so that you can see it properly. You can see it. Yeah, so it's done. And accordingly you first have to unselect it or unselect this, and you can see this. So you can do the mandibular canal nerve canal markings in XYZ view as well as CMPR view. Now the same thing, the exact location, you'll be able to appreciate it well in your CMPR view as well, the cross sectionals. You can just modify the changes to get a good view of mandibular canal. So, and also if you feel like sometimes feel it's going wrong, you can just drag the points. You can just there are control points which you can do the changes accordingly. And you can see this mandible canal. Yes, just press right click, you can lock it and change the color as well. And also you can edit or remove the control points, but that may delete the entire canal markings. So you can just select the as well, like for example 1 So accordingly your mandibular canal now markings, the size will decrease accordingly. So now coming to the case, how to add dental implants. Now, so we first go to curved MPR view. Now we know this is the nerve canal, and on this section, just roughly like you have to usually do on the missing side where missing tooth is there. So basically just mark it from the lingual cortex to the buccal cortex, and superior inferiorly from the alveolar crest till the superior cortex of the nerve canal. So these are my measurements. Now obviously the for implant planning you need to select an implant that is 2 or 3 shorter. So you just have to press add implants. Now basically we'll be doing a customized implant planning here. Now this is for the lower jaw and upper jaw. Firstly, now this is a lower jaw, so we'll just press on the lower jaw. And usually you can do your implant planning in other softwares as well, but here we'll do custom implant. You can select the diameter and the length accordingly. Now the diameter, like the nerve measurement of the bone is around 8.47, so I'll see to it that my diameter is around 6, so I'll just select upper diameter as 6, the lower diameter as 4 is okay, but we'll select 3. And the upper length, I know the length of my bone from the superior crest to mandibular canal is around 12, so I'll select somewhere around 10. So upper length is around 4.5 and lower length is 4.5. We'll select as 5 and 5. Okay, and you can give color as well, so you can just select it, make it red color. Okay, handle color also you can modify it. For example, I'll choose blue color, so you can do the changes. And you can also change the opacity of the implant and cross sectional as well as in volume rendering, and just press create implant. So accordingly now you'll just press this and you can select it according to your need. Okay, again these are just rough measurements, so you can just do the changes. You can always do the changes in all sections, like if you have, so you can do the changes in the sagittal section. You can hide this view lines and do the changes accordingly. Yeah, you can get your implant and change it to other position. Also these changes can be done in the coronal section. So for that, to view in the coronal section, you need to get back your lines here and just drag it so that you can see the implant in your coronal section as well as in the axial section, and orient your implant accordingly and make sure it is not close to the nerve canal. So I'll just get it up. Yes, so you can view the implant in your 3D volume rendering also. Yeah. We are done with virtual implant planning. Now just to view the volume rendering in a proper orientation, what we can do, we can also give static volume cuts. So you just have to press this and cut the volume according to your need. For example, I'll just unhide these lines. Now I want to hide the upper arch, so I'll just press this static volume cut and press this button. But make sure before that your red line is oriented well in the coronal section. Your red line should be above the teeth, and just press high. So your upper arch is hidden now. Now if you want to undo this, just press this undo last cut. So automatically the cuts can be seen again. Now if you want to hide the lower arch, just press this. Now the lower arch is hidden. You can always do the changes by rotating the slices, and then accordingly you can give the cuts. Same way you can just cut this sideways to see how it is looking, and you can just undo it. Yeah, and then press this button, the side ones, and you can view the implant from the lingual aspect. Okay, you can again zoom it by using the mouse scroller and see the relation accordingly, and then press this undo last cut. Now you have this something known as dynamically cut the volume along Y plane, that is the coronal aspect, from the coronal aspect. So just press this button. From the coronal aspect, your entire section is again cut. So you can just move this blue line, and accordingly you can just see it again. So you can just have a look at the mandibular canal as well, the starting point of the mandibular canal, the ending point, that is the mental foramen region, how it is looking. So it's basically again for your patient education purpose. And then undo this. Now there's something known as sculpt the volume rendering. So basically you get this sculpting tool, you can change the volume rendering image, so and you can accordingly sculpt it. So this is the sculpt option. Yeah. And so we are almost done with this software. Coming to measurements and annotations, this is nothing but you can hide the measurements, and the implant also can also be hidden. As you can see, the implant which is there, you can hide it, and the mandibular canal can also be hidden in this specific region. So just hide the mandibular canal, hide the implant, and the measurements which were done in the 3D curved MPR, CMPI view can also be hidden. And if you want to see those measurements, just press double click on that region, so automatically where the measurements was performed, so it will take you on that specific area. So this was everything about the software that will be provided, and apart from that there are some additional small things, like for example you can always do right click and check this, like for example data set. If you want to reset everything and go to this, so just press new, or you can just save the image just by pressing export, and then wherever you want to save the image you can just save it and give the name accordingly. And additionally what you can do, you can also just copy all images and then just minimize and press V, CTRL-V, that is paste. So just see all the images that is there. So everything is already seen. That way you can select anything, even your cross sections can be selected. And just press right click, ruler orientation. If you don't want the ruler, just remove it. Or if you want this orientation, you can just change it on the top side. And thickness, you can bring it to 0.00 as well, or if you want a higher thickness you can just bring it to 12 mm, so accordingly it will change, but it's always recommended to do it in 1 mm, that is ideal. And rest panels, this is again histogram, so your histogram can be seen. So this was everything about this software. Apart from that, there are some certain things that needs to be known, the measurements which are performed. So these measurements are provided in this report to just give the dentist a general idea about the amount of bone available, and you can just double click it and right click on the specific area to check the Hounsfield units, that is the average value. For example, here it is 823.0, so you can just come to know about the Hounsfield value as well. And it is always recommended for the implantologist to study and check the bone or implant dimensions given above, and replan this implant study on the software that will be provided to you. Okay, thank you so much.